Welcome, everyone. I'm Jennifer Patterson, Communications Director at the Global Health Advocacy Incubator. Unfortunately, Abel could not be here today, but we are eager to share some of our learnings around our new Communications and Media Advocacy Action Guide. This is a practical resource for public health advocates to plan, organize, and implement effective advocacy based on the experience of civil society advocates in every region of the world. But first, a little bit about our organization, the Global Health Advocacy Incubator, or GHAI. We use the power of advocacy to reduce preventable death and disease and improve health at scale by changing policies and strengthening health systems. We support civil society organizations and advocates in more than 40 countries to pass public health policies that save lives, reduce disease, and prevent injuries. From making roads safer and ensuring kids get vaccinated, to saving children from drowning and making foods healthier and available, GHAI and our partners are creating a healthier and more equitable future for all. My colleagues will be sharing real-world examples of how we've used the guide in our advocacy efforts, and we have the following team with us today. Lopa Ghosh, who's our Senior Advisor for Communications at GHAI, Belinda Moses, our Associate Director of Communications for the African region at the Campaign for Tobacco-Free Kids, which is our parent organization, and Giang Boy, our Vietnam Program Manager at GHAI. So let's dive in a little bit more about the guide. As I hope everyone on this webinar already knows, effective communication is key to successful policy advocacy outcomes. It's essential to advocacy, and by advocacy, I mean a set of strategic focused actions directed at decision makers in support of specific policy issues. So communications can really help mobilize supporters, motivate policymakers, and turn ideas into successful advocacy. This is why we created the Communications and Media Advocacy Action Guide as a resource for public health advocates to plan effective communications and media advocacy campaigns. Media advocacy is crucial for public awareness, but also to build the political commitment complemented by the public support and demand that policymakers need to see in order to adopt and implement policies, including adding resources and enforcing those policies once they are implemented. The guide is actually a revision of our original guide, which was created in 2016. So if some of you have used that guide, this is a revised version. As the incubator has grown and we've expanded our work to include many other issues since 2016, including immunization, preventing epidemics, drowning prevention, data for health, and overdose prevention, we're able to draw on the collective experience of GHAI and the Campaign for Tobacco-Free Kids, as well as our local partners worldwide who are using the guide to achieve healthy policy outcomes. We realize that some partners don't know where to start when it comes to communications campaigns. So we worked with our team members and partners in every region of the world to identify the key concepts and actions that were common to the most successful campaigns and distill that into a guide that is meant to be usable and actionable. The guide contains a practical breakdown of 8 elements of a public health communications and media advocacy campaign, along with case studies, tips, examples, and templates that you can use in your own campaigns. We are sharing this guide to help advance the field of public health advocacy, as it's designed to help navigate and overcome opposition and challenging political environments. The guide is a companion to our Advocacy Action Guide, which we launched last spring. Also of note, we have 2 more guides that will be coming out this spring as well, a Research Advocacy Action Guide and a Legal Advocacy Action Guide. So those are all already in the works, so watch this space for those. We'll have time for some questions at the end of this webinar, but first we have some examples from 3 different countries of how this guide is being put to use. As we go along, please add any questions you may have to the chat and we will address them at the end. So first, let me introduce Lopa Ghosh, who's our Senior Advisor for Communications at GHAI. Lopa, can you talk a little bit about why media advocacy and communications are considered essential to drive policy change and strengthen health systems, and also why communications has become an imperative in recent times to achieve lasting improvements in global health?
Sorry. Well, it is an undisputed certitude, Jen, that communication and media advocacy are absolutely pivotal strategies in the context of global public health today. And now more than ever, when outcomes of public health, which of course we have learned to approach as a systemic, multidimensional issue, are going to depend on how powerfully and how well we communicate. So suffice to say that all eyes are on us and a lot is at stake. Communications is not just about delivering a message or disseminating information. It is about, particularly when we are talking about communicating for health, it is about sparking change, creating new paradigms, narratives, igniting political will, enabling behavior change. And as health advocates, when we work on driving policy change, we are also simultaneously communicating with strong evidence as to why this policy change is important. What is the human cost of inaction? How many lives will be in peril if no action is taken? In GHI's mission to save lives, driving policy change in over 40 countries as we are, and on multiple public health issues, communication for us is not just a tool for awareness, running social media campaigns or making a noise, as it were. It is for us a driver of systemic and long term change. Media advocacy, in particular, I should mention because it is a critical element of strategic communication. Media advocacy plays a pivotal role, for instance, in creating public pressure, framing issues in ways that resonate with decision makers. So, when we are advocating with the media, our objective is to create an enabling environment in which public health goals get so much media attention that they are prioritized, funded, get multi-sectoral support, and the people that will benefit from it are also made aware in the process. Now, to dwell a little bit on the second part of your question, Jen, communications and media advocacy are indispensable in the recent times because the world has witnessed an epidemiological shift of tectonic proportions, which has led to non communicable diseases accounting for over 60% of global deaths, 70% of global deaths annually. Now, these chronic conditions and their risk factors are some of the most complex and least understood challenges in global health today. So, despite being the leading cause of death and morbidity worldwide, NCDs like hypertension, diabetes, cardiovascular disease, cancer often receive insufficient attention from policymakers and the public alike. To give an example, when we started our work on hypertension prioritization in India and Bangladesh, there was almost no awareness, political buy in, or media sensitization about the fact that high blood pressure was a silent epidemic in those parts of the world. If left untreated and managed poorly, it is also one of the top risk factors for premature death or disability, often resulting in terrible financial catastrophe and income loss. A powerful 360 communication campaign that we ran for several years has now led to more political support for national level screening programs, resource allocation, awareness building, medicine availability, particularly for people at the last mile, that is, people who are living in the remotest parts of the country. I should also briefly mention that in this competitive algorithm driven media landscape, NCDs lack the urgency and visibility compared to infectious diseases, for instance. But it is the need of the hour to keep NCDs in the headlines. And as communicators, this is probably one of the biggest challenges that we are facing today. But this is also where media advocacy becomes our most powerful ally. So, with the burden of NCDs rising exponentially and health systems struggling to cope, we need powerful communications and media advocacy more than ever today. Jen?
Yeah, you raised an important point about silent epidemics. We work on a lot of issues that are really silent killers, drowning, the hypertension that you mentioned, immunization, kids not being able to get vaccines, epidemics that may be right around the corner. to exploding around the world. These are among other issues that we work on, and it's really important to bring those issues to light and show urgency for action, which was a challenge in this day and age where there are so many messages that policymakers are seeing every day. Actually, all of us are seeing every day. We're bombarded with messages, and it's hard to sort of break through that clutter. I know one of the things that has really helped us is survivor stories. They're a powerful tool to raising awareness and bringing that emotional component to an issue that may be hard for people to understand. Can you talk a bit about how you've used survivor stories or testimonials in your campaigns in India and Bangladesh to influence policymakers?
Collecting and using survivor stories is probably one of the most powerful communication strategies that we could use in health advocacy. And it is a strategy that is it has been used, as you said, as you mentioned, Jen, in multiple other issues. But lately, it is receiving a lot of global attention, particularly in the context of non-communicable diseases. Now, these are simple stories, personal stories of individuals or families who have experienced the direct impact of a public health issue. But what they do is that by putting a human face to the statistics, these survivor stories transform silent and often undermined public health crisis or issues like hypertension into relatable, urgent, and compelling narratives that make policymakers sit up and actually inspire them to, and also the public to act. So, our work on hypertension prioritization actually led us to the realization that while we know the data, we have the situation analysis, we know that issues like low awareness, abysmal treatment adherence, problems of access, all of this impact hypertension treatment, particularly in primary healthcare settings, creating loss to follow up. But do we know the whole story? What are indeed the day to day, the quotidian difficulties that create these barriers? How does gender, caste, income, geographical location intersect with systemic deficiencies like medicine unavailability to create, these problems? We felt that a lot was being said about the supply side historically, but we were making top level assumptions regarding the demand side, particularly lives of those who are poor and therefore the most vulnerable. Survivor stories, collecting these survivor stories, and we did that by going out to the remote parts of the countries in India and Bangladesh, and now we have started that process in Nigeria as well. These stories helped us put the spotlight on the lived reality of people who have chronic conditions, and the result. And these are stories, of course, told in their own voice from their own perspective, and the result, of course, is powerful, impactful, and moving in equal parts.
So, thank you, Lopa. Let's take a look at an example. I know we have an example on the screen right now, but I believe we have a video as well that we can show of these survivors, some examples.
यहाँ से गर्भवती महिला अगर जाती है, पहले बड़ खालसा सोनीपत में जाती थी या फिर सिविल में जाती थी। अब फिरोजपुर बांगड़ आ गया है यहाँ पे सीएचसी में, तो वहाँ तक नहीं भी पहुँच पाती है गर्भवती महिला। 8 महीने की प्रेगनेंसी थी, उनको दिक्कत आई है अचानक से, तो वो यहाँ नहीं गए और वो नरेला दिल्ली में गए। उनके बच्चे की डेथ हो गई है।
मेरे हस्बैंड बाहर काम करते हैं, गाड़ी चलाते हैं, ट्रक वगैरह ड्राइवर हैं। तो मैं देख ली हूँ अपने घर में 3 मेरे बच्चे हैं छोटे छोटे, मैं उनके साथ में रहती। तो हम तो जी महीने भी इस दिन में कभी वो आते हैं 1 दिन के लिए 2 दिन के लिए, तभी दवाई दवा के ले आते हैं। 5-5 महीने भी हो जाए, 6 महीने भी हो जाए हैं, महीना भी हो जाए दवाई छोड़े हुए।
That's great. And Lopa, you mentioned that these are often stories from those who are on the last mile, sort of the more hard to reach remote areas. So where are these stories being seen? How are you utilizing these stories in your campaigns?
Thanks, Jen. That is such an important part of patient advocacy. So, one of our main objectives of patient advocacy or collecting the survivor stories is to ensure that these people who are living with chronic conditions, they have a seat at the table. That is, of course, the ideal objective for us. But it is not often possible. So whenever our partners, our civil society partners, or we are organizing high-level national consultations, we try and make sure that some of the survivors that we have relationships with and we are working with in the community, they get to travel and sort of present their story in their own voice. But like I said, it is often not possible, and not just because we are not sort of arranging for the travel and all that. The logistics is not the problem. The problem is of confidence, or if it's a daily wage laborer, they would probably not want to let go of their livelihood even for that one day and come away. So what we do is that we ensure that these stories are captured in the form of video or as a text story, and we almost always, when there is a consultation with a policymaker, we disseminate those stories there. But I'm just going to give you a quick example of a national consultation that we had held in India, where a group of survivors, including a young stroke survivor, he got a stroke at age 30 because of undiagnosed hypertension. They presented a charter of demands to one of the top NCD officials of the Ministry of Health in the country. And then there was another, the same group presented the same charter of demands to a member of parliament. So these are, little occasions that sort of we try and create and ensure these voices are disseminated in. Apart from that, of course, disseminating these stories to the media, to the journalists, telling them whenever we are making a media pitch, we share 2 or 3 of these stories to tell them that, okay, these are the qualitative insights from the community. And these stories also make for very engaging content on social media. Ultimately, Jen, what we do with these survivor stories and how we use them is probably best articulated in a motto that I'd like to borrow from another campaign. Nothing about us without us. Thanks.
Sorry about that. I was on mute. I like that. Thank you, Lopa. Next, we're going to hear from Belinda Moses, our Associate Director for Communications in Africa for the Campaign for Tobacco-Free Kids. But first, we're going to take a look at a video of her work. Wow, that was a powerful video. Can you tell us a little bit more about what we just watched, taking us through why there's a need to create it and walking us through some of the critical moments in the campaign where media and communications have been most effective?
Thanks so much, Jen. And that particular advert comes from South Africa. In South Africa, we are, as the advocates on the ground, are currently pursuing a tobacco control bill. It has been in the mix for more than a decade now. And as urgent as it is, there's been a lot of roadblocks along the way. So communication-wise, it's always important to look at the environment and see what needs to be done at certain moments of the campaign. In particular here, the video we just watched was one communication asset that was created in an ongoing, full-on campaign in South Africa. When I say full-on, I mean that everywhere you look, everywhere you listen, whether it's online, whether it's on the ground, there needs to be noise around this campaign. And this was articulated through an umbrella campaign that's called Protect Our Next. And this campaign came through the insights of talking to general South Africans, really in line with what Lopa was saying about the human face to a policy story. And Protect Our Next actually refers to protecting the next generation, the next economy, the next environment, the next, meaning the future that we all want to see for South Africa. And it makes the tobacco control story a story about everything. And I think that was so important while, advocates came up with this campaign. And for a while, we hadn't seen something that was bold and brave like this. Of course, there's been so many moments within this campaign over the last couple of years that there's needed to be tweaks because either politically things were changing, some of the policymakers that you're even talking to as an advocate, they're also changing in terms of either leaving the space and you're having to also update and bring people on board to why this really matters and why this is so urgent. So this particular campaign is ongoing, as I said, and I think Protect Our Next is a good example of media advocacy in motion. It's not perfect. There's always tweaks that need to happen along the way, but I think there's a lot of grit that comes from both the technical and the communication advocates to try and see if things are working and tweak along the way. And I think that speaks to how the guide is also set up to really monitor your campaign and be tracking all the way to see what is working and what is not. Very specifically in this campaign, because you asked around what were some of those critical moments where you needed to really amplify certain communication activities over others. Well, one example, I think late last year for the advocates on the ground that are leading this was the public hearings that were happening, where again, politicians and the policymakers are coming to hear directly from the mouths of South Africans, why do you need this bill? Why is it so urgent? And there was a lot of disruptions that came from the tobacco industry side in obviously trying to stall that process. And again, this ad was just one piece of the pie when it came to the communication work that was put out. But our advocates were really up front and center, either on television, radio, online, making sure that whatever untruths were coming from the tobacco industry side and the way they were pushing, even sometimes physically, at these public hearings to stop the advocates from speaking the truth. They still emerged, making sure that people understood that we're on the side of truth in the sense that this is better for all South Africans. And all these things that are happening on the sideline is just a sideshow from the tobacco industry. And some of those things that happen really made us think about, is it time to fight back now? Do we say something? Do we stay still? Do we carry on with the messaging that we have? And I think the advocates at the time had chosen to take the high road and to speak out again on the messaging that mattered at the time. And we're happy to say that those processes were unstalled. And there was a culmination of many things, a protest outside Parliament, a collection of petition signatures from just general South Africans to say, no, this shouldn't stop. We need to pursue it further. We're in a critical phase right now, but it's way better than what it was a couple of years ago. And I believe that's in part to working in an agile space, especially on our comms work in the advocacy teams that are leading. Jen?
And I can imagine that, I mean, I can imagine this video being successful because it's so shocking, because the kid looks so young, and people aren't necessarily thinking all the time that kids this young are being influenced by the tobacco industry. So I think it's a good example of being able to get your point across in a very simple way. So let's move on from South Africa to Nigeria. Can you share a lesson learned from a media campaign there that may not have gone the way you had planned? How did you adjust your strategy, and what insights did you gain from that experience?
Well, I guess I would make some connections as well. Like in South Africa, the very specific ask is around regulations, vending machines, accessibility to new and novel products in South Africa, as well as general cigarettes. In Nigeria, there was a very specific example where advocates on the ground rallied together to refresh their campaign around regulations at the time that spoke to the sale of loose cigarettes to young children, meaning you can buy these single sticks of cigarettes very close to wherever children already are, where they live, where they're going to school, where they play. And this, of course, just is obviously very much of a peer pressure to young children who have this, at their fingertips next to their favorite candies and things like this. Well, this was one of the regulations in Nigeria that the advocates there were seeking. And it was so nice to see that even though they were so close to the campaign that they had created, they took a moment to pause and say, why is this not shifting anything right now? The original campaign sought to really look at legacy and look at policymakers who had been a friend to tobacco control for many years and had seen other tobacco control legislation see the light of day. But things were really slowing down, and time was running out for that specific assembly and that specific policymakers to still be in power. So they shifted from having a legacy campaign, like asking their good old tobacco control advocates within government to make another move, by saying, actually, let's look at a more urgent campaign. And they came up with something called Don't Wait, Regulate. Literally, urgent call to action. And it was a bold, very colorful campaign, first of all, very creative, but it pulled together a couple of elements. And again, these elements are also articulated in the guide as part of other case studies, different tactics that you can use, whether it is digital advocacy, a huge billboard outside Parliament to make sure those policymakers see it on the way, a direct tagging of policymakers on very interesting pieces online. And Don't Wait, Regulate actually became very popular very quickly. And that direct call to action, after some time of sitting in the previous campaign, showed that their pivot actually worked. And their action, whether it was TV, ads, radio ads, just being everywhere, saying the same thing, don't wait, regulate. It meant that their efforts were actually, valued by those in power, and general Nigerians were also making their voices heard, going back to the human element. I like that because it's also a lesson to advocates to say, sometimes you might write the best thing on paper, but obviously when it comes to implementation, you have to, look at what's happening at that moment and be able to just, even though you're so close to the work, say, this needs a huge pivot, this needs a change. And that gamble for them really worked, and the regulations were passed. So that was really nice to watch. And when you look back, it's really like a lot of, grit, I believe, again, and a lot of just taking a moment to pause, reflect, and then recalibrate your campaign.
Yeah, you raise a good point about the need to be flexible and to continually monitor and evaluate your campaign and adjust when needed to ensure your messages are reaching the right audience. Evaluation, sometimes people think of it as just something you do at the end of a campaign, but you really need to do it early and often to make sure that you have the ability to shift tactics when necessary. You've also mentioned how big and powerful the tobacco industry is. In today's political context, how have we addressed well-funded opposition and shaped the narrative around tobacco control?
I think the issue around addressing it, it's never here or there because they have deep pockets, unlimited resources, and that's a pure fact. So we need to look at other ways in which, instead of comparing how they do things and trying to match, at their level, because many cases that's just impossible. We need to think of different and authentic ways to try and address what the industry is doing. How do we denounce them, expose them in a way that is more, memorable, not only to policymakers, but to general countrymen? And I think very clearly about an ongoing campaign that's happening in Zambia. The campaign is called Save Zambia from Tobacco. Pretty clear. And it's been also going on, just like the neighbors in South Africa, in terms of trying to pursue a strong piece of tobacco control legislation.
Safe
But
tobacco,
when
I like the name of it. It's very easy. It's very simple. It doesn't have to be
simple,
complex.
absolutely memorable. And when they delve deeper into what that really means, the voices that articulate it so well, over and above, the veteran advocates and scientists and the doctors and all those fact bearers, the youth. The youth have played such an amazing role. And youth advocates have rallied together in Zambia and said, hey, even if the industry is doing this and that, even though we know we will never be able to match the type of unlimited resources that they have, how can we just be real? And we've seen that play out, with them being human billboards on the way to parliament, doorstepping the health minister, FaceTime one-on-one with the president at a side event for something else. So looking for interesting ways to have that kind of FaceTime, to make that, take that stand that is very memorable and to speak as youth voices that not only coming in a sense to just like scream and shout about, but really empowered with the facts and speaking from a point of view of a young person. And I love that because then it shows that, being real, being authentic, and sometimes the most simplest form of like pushback to what the tobacco industry is doing could lie in something that is so simple, like just elevating your youth voices. And that really worked in Zambia. And it's continuing to work as that process, unfolds. They've become the youth advocates, I think, really ones to watch. And I think that in some ways, policymakers even pause a little bit to listen to them more. So we saw that play out. And I think that as we still kind of think about how the industry targets young people, who better to speak, on the side of truth than the young people themselves who are being targeted by the industry? Of course, it's never easy. There's also influencers that work and are paid from the industry side and are peddling a message. But I think like the authenticity of what they're asking and how they're talking and how they bring it forward, nothing can match that. So we will continue, I believe, especially with the advocates leading this on the ground, to just do their planning more purposefully, watch what the industry is doing, but expose the industry and call them out through these voices like the young people that I mentioned, Jen. And I'm really excited to see what they do next in Zambia.
Yeah, I mean, youth voices are very powerful, and because they're so authentic, to get your point across, and because they're the ones that are really being impacted by these industry advertising, and it's affecting their health, so they can really bring that authenticity in a unique way. Um, Lastly, can you talk about how the guide can be applied to tobacco control efforts in Africa?
Thanks for that, Jen. And I know that, every single country, every single campaign, every single alliance that exists for tobacco control or whichever area of expertise we're talking about today, and when it comes to advocacy, have their own way of planning. There's always local things that need to be taken into consideration that will work only in their country, maybe. And some of the ideas that come from other regions might not work. But I think what the guide does is actually give you a step-by-step kind of process that you could follow to help you think through some of those things. Firstly, aligning your advocacy strategy to your communication strategy. It's not two different things. They work in parallel, they work within each other, and they're embedded, if I can put it that way. And I think like all those, the reasons that the guide gives about doing those things early, alignment, mapping, thinking about who's going to talk on behalf of this amazing message that you're going to put out. What are those messages? Where should we speak? All those things. And I think the guide gives you that step by step, and it can work anyway. You just need to localize it to what suits best. I think it's always good to be more intentional and strategic in your planning. That's always nice buzzwords that we hear. But as we've heard from some of the examples now, and even from Lopa, things happen. It's never ever a straight line.
Yeah.
Anything from a natural disaster to something politically, and you have to be able to pivot. And again, the guide gives you some ideas about how to look at different tactics, to think out the box. And I think it's just great that it also shares case studies from everywhere. So you get a sense of what other people are doing. And hopefully you're writing your own case study at the time as you also seek success for your own policy win.
Those are some good points, Lopa. Thank you. Or Belinda, thank you. You're right. You know, the advocacy is never a straight line. And our hope is that this guide provides the steps, but also flexibility to adjust and pivot as necessary. I know that we've gotten a few questions from attendees. This is being recorded, and there will be a recording that will be accessible to attendees after the session. Now I'm going to turn to Giang Boy to hear about some communication efforts in Vietnam to support drowning prevention. Giang, in recent years, Vietnam has been one of the leading countries in child drowning prevention with a really strong commitment from the government. Can you talk about how you've been able to get these topics highlighted among other policy agendas that are in front of the government?
Thank you, Jen, for your questions. So firstly, I want to talk a little bit more about drowning. Drowning affects people everywhere, but it's often not spoken. It can happen to anyone, but it hurts kids and young people the most. So child drowning is #1 cause of death among children under 15, with around 2,000 children dying from drowning every year in Vietnam. Many are unaware that child drowning is largely preventable. So since 2018, we saw that political will exist, but it has not translated into concrete provincial action plans or adequate resources allocation, especially in high burden areas. So at that time, our goals is to, the first one is to increase understanding among policymakers, community and families about child drowning prevention. And the second one is to encourage local adoption and sustained implementation of the program. So from the beginning of the program since 2018, we conducted a mapping exercise early in the program to identify key influencer and communication channels. We have implemented a comprehensive, multifaceted communication approach, engaging stakeholders across all levels with a focus on policymakers. So regarding to evidence-based messaging, we also communicated the scale of the problem using reliable data from the Hanoi University of Public Health. We integrated this data into real-life story of affected families, which has made their issue more relatable and emotional and engaging policymakers around the public alike. And to mobilize media for visibility of the program, we partner with national and local media outlets to ensure consistent messaging about child drowning prevention. We invited media to every advocacy workshop to highlight the urgency of child drowning prevention and preventive measures. Coverage includes press release, documentaries, interviews, and editorials. So we also established a network of journalists covering child-related topics, providing them with local and global drowning prevention information, key events, like recently, like the launch of Global Status Report on Drowning Prevention, or in Vietnam, for example, like interministerial workshop to strengthen drowning prevention. Besides, we collaborated with media agency to track coverage through daily and monthly media clippings, and we share that with the government offices. We also partnered with the Department of Child Affairs within the Ministry of Labor, War, Invalid and Social Affairs, and WHO in Vietnam to build policy champions to amplify their voices and for stronger drowning policy, for stronger drowning prevention policy, and to diversify the scope of the problem. We integrate drowning with broader campaigns such as Frame Drowning as a part of Children's Rights, Children Action Month in Vietnam, climate change, disaster risk messaging. Drowning prevention has been connected to disaster preparedness as Vietnam is prone to floods and water-related hazards. So every year we highlight World Drowning Prevention Day through many creative events like art exhibition and family festival for policymaker, parents, and children.
Sounds like a very integrated campaign in Vietnam, and one where there's never a time where the policymakers don't have drowning prevention issues in front of them. So you're incorporating it into all aspects, and you're making it easy for them to follow what's happening by providing those clips to them as well. It also sounds like personal stories are a common theme that GHAI and the Tobacco Free Kids colleagues use to personalize and really create an emotional connection to the issue.
Yeah, it's true. A personal story put a human face on these issues, make them relatable and understandable. When we hear about how a policy change affects a real person, it becomes much more tangible than just reading statistics data. Yes.
Yeah,
true.
Yeah. It's more than just the numbers.
Yes.
You mentioned that you're working with the government, but what are the other stakeholders that have been you've been able to activate, and how have you gotten the active participation of those stakeholders to support child drowning efforts in Vietnam?
Yeah, I need to say that the child drowning prevention program aims to reduce child drowning by engaging not only policymakers but also parents, children, and the community. They are our key stakeholders. These efforts aim to amplify community action and indirectly influence policymakers for the development of better drowning prevention policies. So at the local level, at provincial level, we conduct a series of communication campaigns through household visit, local television channel, and loudspeaker. And I think loudspeaker is something very unique and typical in Vietnam. Every district, every village, they have their own loudspeaker, and we think that is a very good way to communicate our message on child drowning prevention. So we also standardize our communication package, include infographics, video clips, and distribute across program area. We also partner with a local NGO to develop a special communication edition focused on drowning prevention during COVID time. We demonstrate responsiveness to situational changes and community needs. We also leverage social media to expand outreach and engage diverse audiences with innovative content like a series about cartoon movies, a catchy song called I Like to Swim, and educational short clip on water safety skills. So we also created a hippo mascot called Bobo to promote drowning prevention. To measure campaign effectiveness, we partner with Hanoi University of Public Health, and it was reported that nearly 80% of parents in intervention areas are aware of the drowning intervention measure, compared to only 20% in the non-intervention area in 2022. So, and then the percentage of parents willing to pay for survival swimming classes increased by 44%, 8 times higher than before the project started in 2018. And local funding for program intervention increased, currently mounting to approximately $4 million.
That's wonderful. And you raise a good point about working with a third party, a respected university that can validate how the efficacy of your campaign. That's something that we do in a lot of our programs. We're gonna take a look at that I Like to Swim video that you referenced above now.
Đang ngày nắng và nóng, ta muốn đi bơi một ngày, cùng gia đình bơi đập tan mệt mỏi những ngày cuối tuần. Nhưng khi ta xuống nước để bơi, ta phải nhớ những kỹ năng để bơi trong an toàn. I like to swim, chỉ có bơi nơi sông hồ, phải bơi cùng nhau. Khi bơi phải có áo phao. I like to swim, nhưng khi bơi phải xếp hàng, không bơi ngoài xa, để ta thấy ta luôn an toàn. Kỹ năng để ta bơi trong an toàn, cuộc sống dài đẹp hơn khi ta luôn chuẩn
Ah, that was a very catchy song indeed. Thank you, Zhang. And thank you to all of you for sharing your stories from around the world. Now we have time for a few questions from the audience. Um, let's see. Does the guideline speak to coordinating and executing effective regional communications, for example, among partners in different countries? Do any of our panelists want to take that question?
Well, I could go, Jen. I think it's a very important question. And once you've had a look at the way the guideline or the guide has been developed, it's actually applicable to media advocacy or communications at any level. So at the national level, at the global level, or for that matter, at the subnational and very local level. So these are just basic principles that would be applicable to any context.
Thank you, Lopa. Yeah, there are a ton of examples of the work that we have done from around the world and very localized. So you can see what's happening in Latin America versus what's happening in the Philippines, what's happening in Vietnam. So in wildly different country contexts. Another question, to what extent do you need to test your messages and how do you manage very diverse audiences that perhaps may disagree on messaging? Belinda, do you want to take that one?
Sure. So I think it's very important that, depending on whatever communication asset you are creating and putting out, we have to test that messaging. And we can do so in different ways, either, with focus groups or with literally, I think in South Africa, they even went out and did vox pops, getting sound bites from people, just kind of testing, like, if you heard this, if you saw this. Of course, there's also very specific testing that you can do on social media, and that is a bit more refined in terms of how you do the A/B testing, as they call it. But in terms of like maybe some of the visuals that you're putting out, or maybe even if you're just testing whether something like Save Zambia from Tobacco actually resonates with people, those kind of focus groups are really important. Now, obviously, as noted, there'll be people that will be like, no, that still doesn't resonate with me. And that's when we go in and we segment our target audiences even further, and we tweak the messages to suit those audiences. So maybe if it is young people, you would need to tweak that messaging so they will even understand what you're saying. And I know that especially with young people, they resonate more with the way they speak. We can't be speaking outside the way people generally speak and understand. So you segment your audiences and you tweak your messages, though they still have the same factual basis. You tweak them to suit how those audiences will hear it. And I think, again, that goes to testing, knowing your audiences a little bit more, really thoroughly going to where are they already? Where do they live online, or where do they connect, and how do they talk? How will they digest this information? And I think testing goes a long way, and you will figure out what that looks like locally as you go through the process of mapping out those audiences. Jen.
Thank you, Belinda. Zhang, did you have anything to add to that? I saw your hand up.
Oh, no, it's fine.
Okay. Another question that's been posed, when it comes to survivor stories, how do we capture and use them for advocacy without unintentionally seeming like we're exploiting their survivor experiences?
I'll take that, Jen, because
Okay.
this has been on the top of our minds when we started this vertical of work, that, how do we ensure that we are getting consent from them ethically, that we are communicating to them what is it that we are wanting to do with such intimate details of their lives. So that is, in fact, the most time-consuming part of collecting survivor stories, building trust. And step one is actually going out into the community and ensuring that we spend enough time with them for them to be able to trust us. And we also communicate the impact that their stories are going to have on so many people's lives. That apart, of course, we also ensured that there is a very that there is an ethical consent form And I don't want to make it sound very dry, but the ethical consent form is almost like the form is there where we take their signature and their consent, there's a witness and all of that is there. But the purpose of having that is to convey to them that, we are not sort of exploiting your situation. And I should also mention here that a lot of the times, the best of the stories are the ones that come from people who want to share their story. They want to be heard, they want to feel empowered when we tell them that your story is something that will go up to a policymaker. They want to be heard. So yes, I mean, that's how I would like to answer that question.
Yeah, I think there's some onus in being able to feel like your story may help prevent somebody else from being in the same situation. It gives you a little power back, I think. Another question, do you have specific strategies to identify multi-sector actors that could join a coalition? Zhang, you want to take that one?
Yeah, thank you. So I think when identifying multi-sectoral actors to join a coalition, it's important to look beyond the usual suspect and consider a broad range of stakeholders who can bring diverse perspective and resource to the table. So some specific strategy that like you can consider, like the first one, map the landscape. It's very important that you start by identifying all relevant sector and actors who have a stake in the issue the coalition is addressing, and also look for overlapping interests. Like identify actors whose interests align with the coalition goals, even if they come from a different sector. For example, like a coalition working on child right might include like health or community groups concerned about disaster or flood, something like that. And then we need to evaluate potential contribution of these stakeholders, and we build a relationship with them and be very open and inclusive.
Thank you, Zhang. Another question, in message formulation, how do you manage the difference between individual actions and policy changes? I think I can start on this one. I think both have a role to play in an integrated communications campaign. But when we're talking about behavior change for policy change, when we're trying to create policy change, which is sort of change at scale, so less of individual change, but population change, you want to make sure your messages are reaching the broadest audience. Individual actions, obviously, we need to make sure that people understand the issue. They're aware that the issue is happening, that they can make their own personal changes to ensure that they are either preventing their children from drowning or making sure that they are getting tested, for instance, for blood pressure on a regular basis to manage their hypertension. So individual actions are definitely part of this, but at GHAI and the Campaign for Tobacco-Free Kids, we are really looking to influencing policy change to really make those changes on a population-wide scale. Obviously, individual changes, one person at a time, is very costly and lengthy. If we can make changes at the political level, at the legal level, that has impact to a much larger audience. Another question here. I hope that answered the question. Another question. In the Philippines, there are midterm elections coming up in May. Campaign season may slow us down a bit, and we see this in a lot of countries. How do we ensure the continuity and momentum of a campaign? We're also expecting to negotiate with possibly a new set of policymakers after the elections who may not be as aware of our programming. Belinda or Lopa, you want to take that? I know neither of you work in Philippines, but I know you have experience with election changes.
In fact, this is a very important question, and it sort of also highlights one of the key elements of being a media advocate or basically a communicator, which is basically the resilience that has to be built into all of the work that we do. In fact, there's never a dull moment. So one of the most successful, and this we have seen in our work on food policy particularly, which is a very political issue, is that the more we are resilient, the more we are able to shift, the more successful the campaign is. So it's not as if we are thinking of a campaign or the messaging or the communication strategy as something that is set in stone. So even if before the elections you had a particular set of messages, you even had champion members of parliament. After the election, they may not come back to the parliament. So you will have to engage with a new set. But what really I think would keep one going and to sort of ensure that you hit the ground running after an election in Philippines is to ensure that you're mapping them quickly enough. You already know who the likely MPs are, what are the issues, and therefore you have those tools in place. But yes, I mean, there is no denying the fact that each time such a political change happens, we need to start from scratch and have the ability to pick up speed as soon as possible.
So it really goes to reinforcing the fact that communications is happening often and everywhere. And, we really want to make sure that we are educating all of our stakeholders about these issues that are important and that need their support. So whether we're talking to coalition members or policy members, a large part of our communication is awareness and education on these issues. I think we are almost at time, so let's give a big thank you to our panelists, Lopa, Belinda, and Jang, for these illustrative stories of how communications and media advocacy can raise awareness and put a face to issues and help drive policy change. And a big thank you to everyone who joined us today. Our Communications and Media Advocacy Action Guide is available on our website in English, French, and Spanish, and can be accessed through using the QR code on our screen or by going to the resource section of our website at www.advocacyincubator.org. A reminder to also check out our Advocacy Action Guide and our upcoming Research Advocacy Action Guide and Legal Advocacy Action Guide that will be coming out this spring. We will also be creating online courses for each of these guides as well that will be available this spring through our new Health Advocacy Training Collaboration Hub. So be on the lookout for that. Thank you again for joining us today. If you are interested in learning more about these campaigns or our other work, please connect with us. Thank you. Bye-bye.